Ebola in Texas.
This is the first patient diagnosed outside of Africa, to our knowledge, with this particular strain of Ebola.
The latest on the case and what health officials are doing to keep us all safe. New tonight, we know an ambulance crew in Dallas is now in quarantine as doctors monitor them for potential Ebola symptoms. This comes after the news today that a man in Texas tested positive for this virus. Getting you caught up now. Right now, that man is in isolation at Texas Presbyterian Hospital in Dallas. The CDC said today he arrived from Liberia in West Africa back in the U.S. on September 20th to visit family. 4 days later, he started showing symptoms. On Sunday, he was checked into the hospital. That ambulance crew, as well as others who came in contact with him, are being monitored. It is important to point out this virus is not airborne. You can only get it through direct contact with bodily fluids and only when the person is actually sick with Ebola. Early symptoms include fever, vomiting, diarrhea, and stomach or muscle pain. You saw on KXAN News at 6 tonight how the Centers for Disease Control and Prevention sent a sample to be tested right here at a lab in Austin. The Department of State Health Services says they have taken steps to protect themselves and you from contracting this virus. KXAN's Amanda Brandeis, who has been on this story since this afternoon, has new information tonight from the State Health Services building in Central Austin. Amanda?
Shannon, the test was shipped here to the lab at 9 this morning and at 1:22 in the afternoon was confirmed positive for Ebola. I asked the commissioner of the department what happens next to this positive sample. In Africa, Ebola is now blamed for more than 3,000 deaths. Now that threat is closer to home.
Our thoughts and our prayers first go out to a family up in Dallas. Today, a patient was diagnosed with Ebola here in the state of Texas.
Just 5 weeks after being certified to test for Ebola, this Austin laboratory receives its first sample to test, and it was positive.
When we receive a specimen, first it's shipped to us under special protocols related to hazardous material. We denature it when we get it so that we inactivate it so that you can't get the virus from another individual, and then we do our test, and then we have autoclaves in the laboratory that we can destroy anything, and that kills any of the virus.
The next step is making sure others exposed don't have the virus too.
Over the next 21 days, those individuals that are identified will have their temperature monitored, and then if they become symptomatic, if they start having a fever, then additional tests would be done. I've had several conversations with the director of the CDC, and they are absolutely confident that we can care for these individuals safely and there shouldn't be additional spread.
And Dr. Lakey says the infected patient's chances of survival are better now that he's being treated in the U.S. Now, Dr. Lakey also says it's key that emergency rooms are asking patients if they've recently traveled to Africa if they're coming in with any of these symptoms. Reporting live in Austin, Amanda Brandeis, KXAN News.
And the CDC asked the lab here in Austin to be ready to do this kind of testing as the crisis in Africa kept getting worse. The State Department of Health and Human Services says a blood sample from the Dallas County victim arrived at the state's testing lab about 9 o'clock this morning. KXAN investigator Robert Maxwell has more on how the sample should have made the 200-mile trip.
Protocols from the CDC are specific and designed around federal hazardous materials regulations. The sample in question must be at least 4 milliliters of whole blood in a plastic collection tube. That volume is, well, think of about a teaspoon, almost full. The sample must be transported at 2 to 8 degrees Celsius, keeping it cool, about 36 Fahrenheit, or it must be frozen on cold packs. And finally, here's a diagram for you to study. The sample must be packaged following this triple packaging system. That consists of a sealable specimen bag wrapped in absorbent packing material, then a watertight leak-proof layer, and finally a very clearly labeled outer shipping package. And I noticed in my research for this information, the CDC's webpage for these protocols was updated very recently on September 8th. I'm Robert Maxwell, KXAN Investigates.
We can tell you tonight, state health staff tweeted that the Ebola virus sample was rendered non-infectious when it arrived in Austin. We posted the CDC transport protocols with our story on KXAN.com. Many of you may be wondering now what is being done to prepare for Ebola here in Central Texas. Health officials at Seton tell us doctors at all 11 of its hospitals are prepared to treat this disease. Dr. Carol Rotten says one of the first questions doctors are now asking patients who come in with Ebola-like symptoms is if they've recently been out of the country.
knowing that we're in an environment where Ebola is a potential, those patients would be immediately isolated.
And KXAN also reached out to both St. David's and Scott and White officials to find out what they're doing. A spokeswoman for Scott and White says, quote, in an effort to take every precaution to protect its patients, Baylor Scott and White Health is evaluating its patients per the CDC guidelines. And a spokeswoman for St. David's says they plan to hold a news conference tomorrow morning at 10:30. With all the questions surrounding the Ebola virus, even doctors are looking for some guidance. The Centers for Disease Control has released 4 recommendations. It says any U.S. hospital with suspected patients should first put the person in a private room with the door closed. Healthcare providers should also wear protective clothing, including gloves, shoe covers, eye protection, and a face mask. The CDC also recommends avoiding aerosol-generating procedures, which are essentially procedures that stimulate coughing. And finally, the CDC says diligent cleaning and infection control are paramount. Blood, sweat, feces, and any other bodily fluids will spread this disease. As for the Centers for Disease Control and Prevention in Atlanta, the CDC, we wanted to get more insight on what they're doing now. Dr. Jay Bernhardt is a professor at the University of Texas at Austin and director of the Center for Health and Communication. He spent 5 years as communications director at the CDC. He told us he wouldn't be surprised if they start really putting in the time and effort and money now to come up with a vaccine.
People at the CDC are doing, everything they can. So that involves research in the laboratories, looking at the agents and looking at ways to help prevent the spread and treat the disease. That includes epidemiologists who are tracking the spread and trying to understand exactly where and how.
And you may not have known this, but some of the top research to find a vaccine for Ebola is happening here in Austin. Pharmacy professor Maria Croyle works at the University of Texas. The university says her lab has developed a 1-dose vaccine against Ebola. It's effective in animal tests. UT has been highlighting her research and fundraising as the team is looking to mass produce that vaccine. And as for the situation in West Africa, aid groups say the U.S. military's announced troops to be sent to help build clinics has gotten off to a slow start. Since the start of the outbreak, more than 6,500 cases have been reported. More than 3,000 people have died there. It's the worst outbreak in recorded history. Before this, the worst outbreak was in 2000. At that time, there were less than 500 cases. Just 2 weeks ago, Fort Worth doctor, missionary, and survivor of the Ebola virus, Dr. Kent Brantley, testified in front of Congress. He called the U.S. to take the lead in fighting this virus. Brantley and another aid worker were given an experimental drug as part of their recovery. You can get the latest in-depth coverage on air and online. Just head over to KXAN.com for more information on the virus itself, including a complete timeline showing all of Ebola's recorded outbreaks.